Welcome to the show. My name is Donovan. I'm your host for today. I'm a family mediator and family therapist. So today we have Dr. Tara Quinlivan, psychologist, who we will be talking to. So I think she just arrived, so I'm just going to let her in. Okay, welcome to the show, Dr. Tara Quinlivan,
Hello.
clinical psychologist.
Hello, how are you?
I'm good, thank you. How are you?
I'm very well as any Victorian can be at the moment. Yeah.
Oh, good. Don't get me started with that one. But we'll get to that on a different topic. But I really want to talk to you about parenting and co-parenting. But before we start, how shall I address you?
Oh, please just call me Tara. Quinlivan is
fine.
far too long a name to whack a doctor in front of.
Okay. Okay, if you're happy with that, because some people, you know, they work hard for that title, so you got to say the title.
Yeah, no, just Tara. I often get Dr. Tara from some of the kids I work with, but just Tara.
Okay, cool. Tara's fine by you. Okay, so I guess I invited you here, and I have a little script, but I probably won't follow the full script. But I just really want to talk about, especially now, you just mentioned Victoria with a lot of COVID and all of that thing. And my question to you, and I'm sure a lot of our listeners are also hoping to hear from you about this, is that how would parenting look like, or co-parenting, from if they come to you? What would that look like for you?
At the moment, under COVID?
Mm.
So COVID has definitely chucked a few spanners in the works for co-parenting, particularly in separated parents.
Yes.
We have people working at home, we have homeschooling, we have people living outside of each other's 5 kilometres, which they're allowed to travel across, but it is tricky and anxiety provoking for families. So the practical stresses, let alone all the emotional stresses that COVID has thrown up, has made parenting and co-parenting really, really difficult for families at the moment. And there's a lot of stress.
Okay. So yes, so a lot of the people as well, I know you talked about stress, but also want to give you a bit of a background. I know for a fact that when I say to my clients, because I'm not a psychologist, obviously, and that's not my area of specialization, especially with children and parenting. I could do parenting, but from a psychological perspective, I say, have you tried speaking to a psychologist? A lot of my parents would say, well, I'm not crazy, or we don't have mental health. We have a problem with my children. What would you say to that?
I think that is a really common myth, that you have to be like sick or defective to come and see anyone in the mental health field, whether it's a psychologist or a counsellor or therapist or anything like that. And I think one of the things we don't recognise enough in our society is that struggling with how we're feeling is really normal and really appropriate. And particularly now, when we are faced with, for what in our community is absolutely unprecedented stressor, to experience stress and depression and anxiety and burnout is a really understandable outcome of these stresses. But that doesn't mean you have to sit and suffer through it. And that's where mental health professionals come in. You don't have to sit and suffer through a terrible cold. You can go to your chemist or to your GP. Colds are normal.
Yeah.
Normal to get a cold. It's normal to get any, other kind of ailment. Yeah. But for some reason, when it's a mental health thing, we think that we don't deserve to be treated or alleviated of it.
That's a good point that you said that, because especially for culture, and my culture especially, I'm Filipino, so our culture is quite funny about the term mental health. Yeah. So when we hear the term mental health, we often say, well, I'm not crazy. So how would you dispel this idea of crazy?
It's really difficult, particularly when you're taking into different cultural perspectives, and that I think you would need to do it differently depending on the culture that you're from. I'm obviously from a Caucasian background.
There's nothing wrong with that.
nothing wrong with that. Maybe. But when I like to talk to people about mental health, whenever I talk to families or whenever I talk to young people, 9 times out of 10, the space that they have ended up, it's really reasonable. It's really reasonable why they're feeling and thinking the way that they are. And I wish we could almost have a diagnostic classification that was just like understandable response to like stuff
I like that
is going on in your life, because there are so many parts of us that we often won't see as normal and see as perfectly human, and anxiety and sadness are all perfectly human. But sometimes because of our genetic vulnerabilities, or because of our personality vulnerabilities, or our coping vulnerabilities, or our learned and lived experiences, we may experience sadness and anxiety in a way that is really disrupting our lives. And we deserve to be helped for that.
Okay. So, I mean, what I'm hearing you say is that really it's normal to feel sadness or depression, but for some reason, I think it's not just my culture, but even now, when people, especially in my practice, when I come to, well, we're in the same field, when people come to me and they say, well, I'm not crazy, why do I need help? And I often have to say to them, well, you don't have to be crazy to need help. And I said, so where did you get this idea of crazy? Do you have an idea where people might get this idea about crazy?
Yeah, well, I think a lot of it is historical.
Okay.
I think a lot of it comes through the way that we have treated people who show any form of difference across time. And we do not like people who do not adhere to the norm. And we've often wanted to vilify or to separate them out. And I think that's where the idea of crazy comes from. I think there's also this sense that if people aren't able to do things, depression and anxiety are really debilitating disorders, and they will make it really difficult for you to engage in your study, to engage in your work, to do things that other people find that they are capable of doing. And rather, I think, than people acknowledging, well, that could happen to me, I could be similarly disabled, we want to say, well, something's wrong with that person. They're lazy. They're making it up. They're crazy.
Yes. Okay. So really, this idea of or notion of crazy is really historical, and that parents should not feel that if they come and see you or I or somebody else to bring the children for a bit of therapy, it doesn't mean that anyone is crazy. Is that right?
No. And I think the other really, really tricky thing that parents experience is, I think there was for a while a culture sort of back in around like the sort of the 50s and the 60s where it always, well, it comes from the mother. There's that real, that legacy of Freud, and,
Yes.
they even had a horrible term in the 50s, which they would call them the refrigerator mothers, meaning that they were cold and unavailable. And I think parents, and I'm a mother myself, have this fear that if something's happening for my child and I need to seek a psychologist, that psychologist is going to think that I am a terrible parent.
Okay. Well, that actually is very informative, because I'm hoping that everyone that's listening to this podcast, that parents, especially mothers, would think that it's okay to ask for help and that they're not cold.
Absolutely.
Yes. Because I guess a lot of people are overwhelmed with information as well. And there's a lot of stigma around mental health still. What are the common issues or problems, or I don't want to say issues or problems, what are the common theme that parents bring to you when they bring their children to your practice?
So my three that I often say to kids when they come in, because kids are a bit reluctant to talk, obviously, because I'm some random new lady. But I normally say families will come to see me for one of three reasons. When there's too much of one feeling happening in your house. And that might be that there is too much sad, mad, or worried is one of those three things happening for you. And typically kids can go, yeah, and they might kind of grab my finger and go, that one, or they might be like all three. So that's sort of the main reasons, that if kids are just really struggling to manage their anger and the anger outbursts are really big, or lots and lots of anxiety, or just lots of sadness.
Okay, which is a good segue to bring you to the real purpose of my question, and it's not to entrap anyone or anything like that, is that I know for a fact I did a session on this in June for Wyndham City Council, and I talked about understanding your parenting style. And one of the things that came out as a comment from there is that I thought you were going to teach us how to control our children, but instead you talked about how my parenting style might be deficient. And so I said, well, we need to look within before we can start looking outside. Do you have any, do you agree or disagree on that topic?
I think probably, I don't know if I would necessarily agree with the word deficient.
Okay, fair enough,
but
good. I'll change my word.
And maybe that's just me as a parent. I feel like I'd be horrified if someone said that to me about my
Thank you for the feedback. I will change my whole session for that one.
But I think what you're tapping into is this idea that, and again, I think this is one of my biggest frustrations with a lot of the parenting literature and a lot of the self-help parenting stuff, is there is this illusion that there is a way, there is the parenting way. And if I can mold my children enough, they will never cry, and they will never be angry, and they will never kick, and they will never, and it's absolutely delusionary. That is not in any way the way that humans work. And I think what you're tapping into is that parenting is a relationship.
That's right. Thank you for that.
And so when we're talking about how we parent and the deficiencies, I think you were mentioning.
Sorry, I'll change my word.
But I think what you're tapping into there is that when we're trying to, and I do this similar sort of work with parents as well, what I'm trying to do is help them navigate that relationship in a way that works for them as an individual and their child as an individual.
Okay. Good, because I'm not sure if you're familiar, and I've got this book ready for you.
Oh, yes, I know the body keeps a score. Yes, I actually have done some training with Bessel van der Kolk.
Oh, wow. I want to meet the man who wrote this book. Because,
very interesting man, yes.
To be honest with you, it's actually one of my students when I was teaching at the Victoria University. And one of my students said, have you read this book? And I said, no, I haven't. So I bought the book. Ta-da! And I also bought the audio. So I'm listening and reading at the same time. And I'm like, wow, this resonates with me. Because I'm working on a book, and I said, and I've seen this with children in out-of-home care, and children would say, you know, why should I change? My parents are like this. And so I was like, oh, okay, that's an interesting concept. I said, so I know I said deficiency in parenting. I will take that back. I'll change my wording when I present this paper again. But what I meant is that there's an article that was posted by a friend, colleague, Susan Hamilton Green. She's an independent children's lawyer. And the post that she put on LinkedIn was called Wounded People Wound Children. Mm-hmm. I'm not sure if you're familiar with the article, if you've read it.
No, I'm not. No.
Okay. So it talks about how when parents have unresolved trauma or mental health themselves, and so when they parent from that parenting where they didn't know any different, not using the word deficient, they don't know any different. So because they have unresolved issues themselves, when they parent their own children, they then, how would you term this? They're parenting from what they've learned. I don't know the right term. We'll have to come up with the right.
Yeah, they're going to replicate their experience of being parented. And most parents, no matter how insightful or how different you think you are from your parents, I think that's a fairly standard experience. You know, I can even say things and go, I just heard my mother come out of my mouth.
I turned to my mother.
and I think you know, as just everybody can relate to that, that you parent the way you were parented. But yeah, what you're talking about there is kind of the more extreme end of that, how in those situations of trauma that if you haven't experienced a warm and a safe and a receptive parenting experience as a child, well, that you can't create that out of, actually no, some of the research shows that new relationships across time can help you repair and change that. But if you don't get those new relationships, if you continue to experience the same sort of models of relationships, then when you become a parent, you've got nothing in the tank, you've got nothing else. And so you're likely to replicate the experience of being parented that you had.
I found my new word, replicate. So you parent from your replicating your parents. And so and I know you just said replication, and I call it deficiency. In other terms, we call it also intergenerational trauma, where you were parented that way, so you replicate that parenting style, and then you replicate that again, and so it becomes an intergenerational trauma. Is that right? Would you say that would be intergenerational trauma?
Yes. So sorry, that would be one form of intergenerational. Sorry, our Zoom went funny for a minute there, but we're back.
Okay,
one form of intergenerational trauma where perhaps because of environmental stresses or issues that someone wasn't able to have the experience of parenting that may have been ideal, and then they will pass that on to their children, who then also don't get to experience that warm, safe, secure. So we talk about this in attachment theory as a secure attachment, where you don't get to experience that secure environment, and then you don't get an internal model of that environment. So when you become a parent, you just continue on.
That's a very good way of explaining it, because sometimes I talk to the parents about this. I said, well, how were you parented, and what's your the model of parenting you've got? And I talked about which I'm gonna ask you about your opinion on this, because I talked about culture earlier, and a lot of the parenting sometimes, especially when I deal with a lot of the culturally and linguistically diverse people, is that they would often say, well, this is how culture has taught us to be parents. And so I don't understand why when we come to Australia, we can't parent this way. And when I say parent this way specifically, I had a client that said, when I was growing up, we got spanked. Why can't I spank my children here in Australia? And I think that's the reason why my child is out of control, because they're not afraid of being spanked, because I can't spank them. What would you say to that?
So I think particularly with spanking and being hit, we know that in the research shows that does not in any way modify children's behaviour in the research groups that it has been tested in, which may be predominantly Caucasian. So I'm not 100% sure on the cross-cultural studies around that. But from what I know, we know that smacking a child is just likely to make them more defensive, reactive, and actually be sneaky, naughty later on. I think the interesting thing when we're talking about things from a cultural perspective is different cultures will have different parenting styles, and you may have a culture that, well, different individuals in different cultures will have different parenting styles, but you might be able to typify one culture as being more strict, more authoritarian. The thing is, that actually doesn't really matter, aside from any kind of physical violence. if you are a more authoritarian parent, you can still do that with a lot of love and connection.
Yes, and that is so true. It's funny you mentioned about authoritarian parents, because in the presentation that I did for Wyndham City Council, was that I talked about that, you know, the different kind of parenting style. And so I might just quickly show you, and before we move on to my next topic that we were talking about, and just to round this, is that and one of the things that I talked about to parents is that the 4 different kinds of parenting style. Now, I know that we just mentioned ourselves that there are different kinds of parenting style for different cultures, and one of the things that okay, I lost my where is it? Sorry about this. There, I found it. So I'm going to share you my screen quickly, Tara, and I want your opinion on this. And let's see if I can get it. Okay. Just quickly, Tara, can you see my screen? Yeah?
Yep.
Okay, good. So I might actually make it bigger so that people can also see it, if I can. So in here, it says authoritarian, authoritative, permissive, and uninvolved parenting. So I did talk a little bit about this, and you talk about authoritarian. So can you provide a tiny explanation for which one of the, for all of these, just for our clients, if they come to you and so that they've got a better understanding of their parenting style, what would you say to them?
So I'm probably going to have confused your listeners by using lowercase authoritarian, and there is uppercase authoritarian as a proper noun.
Love it.
So in this model, authoritarian parenting is where you are the director, the directress of your children. You are the absolute unquestioned leader and master of the house.
Yeah.
Authoritative is when you are still in control and you are still providing direction, but it is just that, it is direction. It's not my way or the highway. It has a more collaborative element to it.
Okay.
Permissive is just your free for all, have at it kiddos, good luck to you.
Okay.
And the uninvolved is that what would probably fall into that more sort of negligent, just really being quite I can't think of the right word, but I'm trying to find a word that's not the word uninvolved, but not engaging with your children in a way that helps provide for their basic needs of security and safety.
And I think it's changed as well. And just to add on to that, Tara, is that I think with uninvolved, and I mentioned this, is that when parents spend most of their time on their phone, and then children are calling them and say, mom, 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 or dad for that matter, let's not stereotype mom. We just did that in the 50s, so let's not do that again.
Yeah.
Or mom, dad, and they're like, go, just do it. So they're uninvolved.
Yeah, parenting through devices is a huge problem.
Yes.
And one that we know that the research is starting to show is more problematic for your children's well-being than their engagement with devices.
Okay, that's a good point, because one of the things that I actually do as a family therapist is when I ask parents, your child mentioned this, that you're on the phone, and the parents would say to me, well, my child has just got ADD, ADHD. And I said, tell me about this. What would you say to parents that just, I know you're a psychologist, I'm not a psychologist, so I don't do diagnostic. So you might totally disagree with me on this one. And I often say, well, before you had your child diagnosed, what was your parenting style? Would you ask that question as well?
So, I mean, I would. with someone who's been diagnosed with ADD or ADHD, and I hope, I would have hoped that they would have had a very rigorous assessment process.
Good.
So if I can assume that of my colleagues who have maybe made that diagnosis, what I would be really wanting to see is that hyperactivity and that difficulty with attention is occurring irrespective of environmental constraints. Irrespective of that. So even when you change the environment, even when you give them you model fabulous attention and all of that you would be seeing it, you'd be seeing it across environments, across situations and across time. So if you've been given that sort of diagnosis, it really should be that all-encompassing symptoms. They shouldn't be reactive. But you can definitely see kids who don't necessarily have those diagnoses, but have some of those behaviours in response to devices and technology and things like that.
Okay, that's really good, because it makes me it makes me understand what it is, because not being a psychologist, so I do have my reservation about the whole diagnostic. I'm like, I don't know anything about diagnosis. I just know how to work with family.
Yeah.
When family comes to me, well, my child has been diagnosed with this. I'm like, well, do you want my help, or do you want to just tell me what your child's diagnosis is? And so it's very difficult. And I think, and I would say this, if I have another client that says to me, my child has have a diagnosis and all of this, I think I might have to refer them to you. Hopefully you have room to take on some of my clients with
I'll make room for you, Donovan. I'll always make room.
Thank you for that. Okay, because I'm still learning, and I'm of course, you know how big the book is, the DSM-5. I'm like, I don't know how anyone could read this book.
You can get a smaller version. I've got a little one. You can get the pocket one.
Oh, mini one. Okay.
The mini reference guide.
Good, because me reading that big one, I was like, oh, I'm bored now.
Yes, it is. It's a good one to read before bed.
Okay, oh, no. Okay, I'm just mindful of the time, so I just want to wrap this up. And the only question that I really want to ask is that I hear this term often, complex trauma, complex mental health, and I'm not sure if you deal with this a lot, but when I certainly work in child protection in out-of-home care, we often hear child protection workers saying to us that when the child is brought into the out-of-home care, that the child has complex trauma or complex mental health. When I ask, the question is, well, can you tell me why is it complex? And I often get well, you should know, it's complex. You work in the field. I'm like, well, no, I don't know. You haven't told me anything. So I want to hear from a psychologist, what is complex trauma, or what is complex mental health?
So I think really the first thing that springs into my mind is it means that a lot of stuff has happened to this person. And if you like Bessel van der Kolk, I think he talks about it, but Beth Rothschild talks about it as well. Sorry?
Judith Herman, who originally worked on complex PTSD.
Yeah. So they'll often distinguish between someone who has experienced one acute stressor. So life has gone along pretty fine. They've had their regular ups and downs, but then they have a horrendous car accident, and that then sets up some mental health symptoms for them. So that would be a fairly straightforward trauma. So that would be like a level 1 trauma, they might call it in Babette Rothschild's classifications. Yeah. That it's one thing has happened and we can see really clearly what the result of that has been. Okay. A complex trauma is something, particularly if you're working in the child space, where they may have had a lot of traumatic events across their life. So that might start with things like, if we're talking that real child protection, that real pointy end of things, it might start with family poverty. So it might start with the family's experienced poverty and they've experienced significant hunger and deprivation.
Thank you for mentioning poverty, because I often say this to my colleagues is that we don't hear poverty anymore. It's always about the mental health and AOD, and I say goes back to the basic poverty, because I know that Maslow's hierarchy of needs has been have been said that it was too it's incorrect, but we still have to go by the basics of it: food, shelter, all of this, and when I worked with young people, and they would say that the child is having a psychosis, my first question, and I still do it now: when was the last time you had water? When was the last time you had food? When was the last time you had proper sleep? You can imagine that a person who hasn't ate properly for a long time, hasn't slept properly for a long time, hasn't drunk water because they've been drinking the other stuff, their mother or Red Bull, nothing wrong with any of them, but if that's all they're drinking, their body is in shock. And that's why they go into psychosis. And that's why, for me, being a non-medical practitioner, I often ask the question, when did you have your proper sleep, food, and drink? And it's interesting you said poverty, because I think we need to look at the basics one more time. Not one more time. We need to go back to the basic again. Yeah. Poverty.
Yeah, and I think, particularly in this time when we're experiencing a recession, yes, and we are likely to see a rise in poverty. And again, there's lots of negative connotations for people when they are struggling financially. And we often want to think that our wealth is a product of all of our grand choices and our sterling personality, when the reality is a lot of it is luck. Yeah. And if we really want to be supporting people's mental health through this time and over the next 12 months, we really need to be focusing on things like poverty, because that will help alleviate so many of the stresses that can lead to that complex trauma that you were talking about.
Thank you for that. So any last word to wrap it up, any last word, or how can my listeners seek you out if they think that, hey, that Dr. Tara Quinlivan just provided such great information? How can they contact you? First of all, wrap it up for me. What is your message to our listeners? You are part of this, so our listeners.
I think my message is, with mental health, knowledge is power. Mm-hmm. Forewarned is forearmed. Okay. There are so many times when I'm talking to, I work with schools, and I work with families, and I work with individuals, and I work with youth organizations. So many times I'll be able to sort of spell out what is happening and the psychological reasons as to why those responses are happening. And you can see the light bulbs go off in people's minds. And they're like, oh, of course, that's why this is happening. And when you have that why, the strategies to resolve it just flow. So seek out mental health support. All it is a sounding board, a way to unravel and organize your thoughts in a way to help find solutions that is going to make your life and the young people in your life make their lives better. So so if you want to find me, you can find me at Raft Psychology, so Raft like the boat, RAFT psychology.com. And I've got some free articles on my blog there if people want to get a little bit of information around talking to children about anxiety, managing parental anger. And I've also got some information about the return to school post-COVID, which will be significant over the next few weeks.
I want to read that too. I know you sent me the blog the other day, but I still haven't got around to doing it. Naughty of me.
Very naughty.
Yeah, I will read that. Well, thank you very much for the information that you've given us. And I hope that the listeners understand that when they come to seek out help, whether for their children or their own parenting style, whether they seek out a family therapist like myself or a psychologist like yourself, it doesn't mean they're crazy. And we need to dispel that term. It's not crazy. I know it's a stigma. There's a lot of stigma around that. But we need to dispel that term that somebody's crazy when they come and seek out help. But instead, they're just seeking out help because they need scaffolding. Would you say scaffolding would be the right term?
Yeah, I really like using the word scaffolding, because I think it conveys that image that we're not fixing them. We're
Thank you.
helping them rearrange things. We're helping them
Yes.
rearrange their thoughts and their feelings in a way that better supports them and their families.
Yes.
And there's this great analogy in mindfulness that I can see your mountain because I'm over here on my mountain, but my mountain's right in front of my face and it's hard for me to see it. And that's what a therapist is. We're there to help see your mountain and clear the route for you.
And just to end this, I want to thank you again for mentioning we're not here to fix family, because when I was working, I don't work in out-of-home care or child protection anymore, but I hate it when child protection people come to me and say, fix the family. I'm like, I don't fix family. I work with them.
They don't need
and then
to
we
fixed.
find solution together. And they go, oh, you have 3 months to fix the family, or the child will be removed, or children will be removed. I'm like, that's not a very nice thing to say. So thank you for saying that. We don't fix family.
No, we support them.
Yes. All right, Tara, thank you very much for coming. And look, and I will read your blog, and hopefully everyone else would read the blog about the return to school, because that would be one thing that's really difficult. Thank you. Have a great day, and we'll invite you again for the next topic.
Fabulous. Thank you.